On this World Cancer Day, me as a fertility specialist would like to convey message to young cancer patients. This is to make them aware that they can preserve their fertility in spite of having cancer so as to have a biological child in future whenever they are healthy and when they want. This is what is called as fertility preservation. That means you can store your eggs, you can store your sperms or your reproductive tissue which can be used at a later date. Infertility, that is difficulty in having a baby, can arise as a consequence of going through cancer treatment. So cancer therapy, which can involve surgery, chemotherapy, radiotherapy or a combination of any of them, can have a significant impact on fertility, which can cause a difficulty in conception later at a future date. So there are options for fertility preservation which depend on their age, the type of cancer and the type of treatment. In women, the treatment could be either giving a hormone protection to suppress their ovaries or moving their ovaries away and placing them at a safe place so as to avoid the site of radiation. One can even freeze their eggs or freeze their embryos. That means the egg which is fertilized with the sperm if in case they are in a stable relationship or even an ovarian tissue. Similarly, in men, one can store sperm or a testicular tissue which can be used at a later date. So the question is, how long does this whole procedure take? Because the time is short and you cannot wait for a cancer treatment. Normally, this may take about 2 weeks. Rarely it can extend up to 3 weeks. So it can be done either before a cancer therapy or in between two kinds of cancer treatment, like following surgery and before chemotherapy. The other question is, how long can it be stored? Normally, these gametes or the reproductive tissue can be stored for a period of 10 years and they can be extended in case of any need. A young cancer patient obviously will be very disturbed and distressed after knowing that they have cancer, and a decision for fertility preservation is difficult to make, but definitely it seriously need to be thought of. And the individuals at the risk of losing their fertility and their parents need to be given ample opportunity to have a detailed discussion and counseling regarding fertility preservation during this cancer treatment. The time is precious and short. A timely, conscious and a decisive action might help to preserve future fertility in these young cancer survivors who has a good prognosis and has a good chance to fare well with cancer treatment. Improved cancer care and increased cure rates have not only improved their survival chances for a long time, but also advancements in fertility treatments and fertility preservation fulfills their dream of having a child of their own in these young cancer survivors.